Hi, Dr. Henry. Thanks for this. I know the number of people in self-isolation or under public health surveillance is now in excess of 3,600 people, an increase of almost 500 since Friday. Just when we hit 1,000, that seemed to be a big deal. Now we're approaching 4,000. I'm just wondering, from a resources perspective, how much more challenging is this for your team to keep track of what is a steadily growing number of people? And is it going to reach a point where not everyone can be always checked on?
Yeah, so this is something that we started reporting after the July 1st long weekend, because I really wanted people to understand the work that public health teams were doing in finding people who are at risk and supporting them. As we know, when somebody's had an exposure to this virus, they often have a lot of questions about what their risk is, what they need to do, and then we support people if and when they develop symptoms to make sure they get tested as well. And yes, we've seen an increase as we've seen our numbers increase, and that reflects the numbers of contacts that people are having, and that's why it's so important that we try and minimize those, keep our groups as small as possible outside of those key things that we need to keep our community going, including our schools and our workplaces. So yes, we have also spent quite a bit of time over the last few months hiring and training contact tracers. You've heard Minister Dix report on that over the previous weeks. So we've got several hundred new people working on public health teams around the province to help support this important work, because it is that balance of us all doing our part, which people in BC are doing well, and public health being able to find people and support them to self-isolate when they need to after an exposure.